Thank you so much for watching Imani Television. This is your number one TV station that builds your faith in Jesus Christ. My name is Barasa Saenyi. Welcome once again to Health, Hygiene and Wellness. Happy new month of February. This month we will have many episodes of Health, Hygiene and Wellness where we'll discuss about our health and understand much. In our studios today we have Dr. Silas Wambulwa, ready as always to demystify more about cancer. We are going to discuss about cancer today, and it's cancer in general. As we are aware, on the 4th of February is Cancer Day. So it's important that we create awareness so that as we live, we know what we should do in order to prevent ourselves from cancer, as well as how to live with it for those who are the patients. So stay tuned to this program and be well informed. Karibu sana daktari.
Thank you so much.
How is today? Uko salama?
Niko salama. We thank God. It's a new day.
Yes.
It's a new month actually. Mm-hmm. We thank God. Yeah.
Now we are going to discuss about cancer.
Yes.
And maybe if you can give us a preliminary information about cancer. What is it, so that we can have a little understanding about it?
Yeah, I know when we talk about cancer, everybody usually gets scared. That's how bad, how good I can start my statement with.
Yes.
But today, as we'll be learning a lot, we'll realize that cancer is one of the most preventable diseases that we have in the world. And actually, our main role in the care provision when it comes to cancer, our mainstay like healthcare workers is prevention. So cancer majorly is a very unpredictable disease. No one knows if they'll have cancer in their lifetime. It just comes. You can never guess that this person will have cancer. Although we look at the risk factors for cancer.
Yes.
But at least cancer is a disease that is coming up, as you've said. If you compare 20 years ago and now, many people were not suffering from cancer.
Yes.
Especially in the communities that were not living in the urban areas. They could rarely have cancer. But cancer is an old disease per se. In the ancient days, most people used to treat it as a traditional disease where they could think the growth has become like people have been, maybe it's because of witchcraft or other things. So people feel like if you have a swelling on your body, maybe there is somebody who did something traditional to you. So that was cancer in the old days. And you realize that there are very few people who would have those growths on their body. People could think it is a traditional thing. Maybe they usually say in our language, umerushiwa. So people used to think it is actually a traditional disease, but it was cancer. Any growth on your body that was there those days and it was bleeding, or maybe a wound that was not healing, it was bleeding, it could have been cancer. So if you hear from our grandfathers or grandmothers, they tell us somebody died of a very big growth and it just started and it continued for a very long time and they lost their life. So cancer has been there from the ancient days, but the incident was not too much. But looking at our current age, our current world, even Kenya today,
yes,
cancer incidents are very high. And if I can say, cancer is just an abnormal growth of cells, maybe in shape, in size, or multiplication. You know, there's a way your body controls how your cells
reproduce or multiply.
And also there are cells on our body, for example the skin, that shed off. So when the skin has cancer, for example, those cells will not shed off. They'll keep on multiplying and it will be called a growth or a tumor. So once this tumor grows, it invades the nearest organs and actually it causes some pressure symptoms. That is when you develop the symptoms of cancer. But cancer per se is just an abnormal growth of cells, abnormal shape of cells, and maybe uncontrolled multiplication of cells. That is cancer.
Uncontrolled.
Yeah. Yes.
Now, we are talking about the third leading cause of death after the infectious diseases as well as the cardiovascular diseases.
Yes.
And over time, there have been research about the treatment, chemotherapy, and how we can combat cancer.
Yes.
How is it? How is the research making a difference, Dr. as at now?
Initially, what I can say is that, the world was not looking at cancer in terms of investing a lot of money in cancer. But currently, we are looking at it being the third cause of death after infectious disease. Like, if I can cite an example of Kenya, we are pumping a lot of money in TB, malaria. That's why you see people in the villages coming to your doorsteps telling you to protect yourself from malaria.
Yes.
HIV, there are people coming to your doorsteps wanting you to test for HIV.
Yes.
There are people coming even to your doorsteps bringing mosquito nets. Why? Because we are looking at infectious diseases. But people are not looking at cancer. Why? One is because of the cost. The cost of screening for cancer is very high.
Yes.
And that's why we've been pushing NHIF to come in and support us in screening for cancer. And we encourage everybody to have their NHIF cards. I know it comes with its own challenges, but it beats, if you compare a person who has NHIF and a person who does not have NHIF, the person who has NHIF is better off than the one who doesn't have NHIF. So forget about what people talk on the streets about NHIF and everything, but you just have to have NHIF. Number two, when it comes to research, actually the world is now moving towards research on cancer, especially the commonest cancer cases. I'm glad even the National Cancer Institute currently has opened up research for cancer, especially cervical cancer, and the commonest cancer, prostate cancer, esophageal cancer, those cancers that are killing people, breast cancer. So people need to come up, even those people who are doing a lot of research need to come up and start doing research. But the challenge that we also have on cancers is that there is a lot of mutation. So what you learn this year on this cancer might be very different in the following year. So it's just like Corona. When COVID came, we thought we had got the strain, the strain that we were treating.
Yes.
And after some short period, there was already mutation, we were having another strain.
Yes.
So it's a challenge when it comes to these cancers, that things that affect RNA and DNA, it is so hard for you to control. But all in all, there's a lot going on cancer research. At least currently we have in Kenya, we have the National Cancer Institute. We also have the National Cancer Control Program that are very keen to be notified on all cancer cases.
Yes.
We have a cancer registry. So all these cases of cancer that are diagnosed in Kenya currently must be captured. Unless those people who get cancer and just decide to stay at home, they never come to the hospital, those ones, we lose them. Yeah.
Now, if we can look at the graphs, the demographics, the cases rising or they are coming down?
No, the cases are rising. Last year was a bad year. We lost many people because of cancer. And I think even the viewers who are here today, who are listening to me, can attest to that. If you take a flashback of your 2023, how many people did you bury because of cancer? There are many. Most deaths nowadays, if it's not diabetes, if it's not hypertension, it is obviously cancer. So people are dying of cancer. The incidences are increasing, even in the villages. People used to think cancer is a disease of the rich. People used to think cancer is a disease of those people who stay in towns. But no. It is not true. Cancer is a disease of everyone. Anyone can get cancer. So as long as you have cells in your body, they are at risk of changing to cancer. Although there are other risk factors that we look at, like maybe family history and other things. But the incidences are going up, the graphs are going up, the numbers are increasing. Like initially we used to have less than 30,000 diagnoses, but currently we are talking of more than 30,000 diagnoses in a year. So we see those are very big numbers.
The numbers are rising.
The numbers are rising. Yeah.
Now, Dr. as we talk about cancer, how does it grow and spread? I'm asking this because someone asked, Can an injury cause cancer?
Injuries cannot cause cancer. Why? Because it's just a break. When you get an injury, you break your skin. So there is an access of microorganisms to your body, because the skin is what covers your internal organs from any other organisms entering the system.
Yes.
Cancer comes from the cells in your body. There is always a trigger. You know, when you grow up, when you are born, your body will always have a risk. Everybody, they always have a risk for cancer. But now there are those triggers. For example, you start smoking cigarettes. So this nicotine, these components that are there in the cigarette, will give you a risk for cancer because they are triggering these cells to start multiplying. Another example is, for example, human papilloma virus, a virus that causes cervical cancer. This virus will just trigger the cervix, the cells of the cervix, to start growing up abnormally, and you develop cervical cancer. So there is always a trigger. And the other people who are born in families where there is what we call gene mutations. So instead of a cell growing in this shape, it starts growing in the other shape. Then when they grow in that shape, they are not normal cells. They overgrow. They need a lot of blood. They start bleeding. Then they start spreading to the other cells. They start changing the cells of the other parts. For example, if you have a cancer of the neck,
Yes.
it spreads to the esophagus, or maybe it spreads to the lungs. So when it reaches the lungs again, it invades the cells of the lungs. They start changing those cells of the lungs.
Yes.
So that's how cancer spreads. So if you get an injury, rarely will you get cancer, although there have been cases where people got injuries and those cells changed. For example, if you get an injury and you get a scar, we have scars we call keloids. So keloids are not precancerous, but they are benign growths on the body. So it might change to become cancer because it's a scar. So a scar is a different shell. It is a different cell and different shape of cells compared to the original ones that were there. That's why when you look at the skin of a scar, it's not the same as the normal skin.
Yes.
So it can change to become cancer, but rarely. Yeah.
All right. Can we now look at the risk factors for cancer?
Yeah, and that's where people really need to listen, because currently, I was looking at the internet, and the kind of life people are living is not good. And my strength, because I am a young man, my strength goes to the young people.
Yes.
I always tell people, the life you live from 20 to 35 years will determine the kind of life you will be after 50 years. So if you see people who are having diseases after 50 years, it's not that they lived their life, this disease started at 50 years. No. The chips that you are eating at 30 years, at 25 years, at 28 years, that chips, that soda, that alcohol, that smoking that you are smoking at 30 years is the one that will determine your outcome at 50 years. So you just have to be keen and live a good life from 25 years to 35 years, period. As long as you don't live a healthy lifestyle at that time, and people say you have a lot of energy but you don't have money. But the old people have a lot of money, but they don't have energy. So they are the ones you will call your mother and tell them, kula ugali ya wimbis. You do what? Don't take soda. And you are there in town taking a lot of soda. You are doing what we call shere. And those things will cause cancer when you get old. So I'm pleading to the young people of this nation. In the coming years, the rates of cancer will be very high. So we kindly encourage you to eat healthy. And what is eating healthy? People think eating healthy is eating butter and bread. No. Eating healthy is what you thought is cheap, but it's very expensive. If you go to the market today, the price of vegetables is very high. The price of carrots, the price of hoho, dania is very high. You cannot compare it to bread and butter.
And butter, yes.
So things have changed. So invest there. Invest in the vegetables. Invest in crops that are coming from the farm, directly from the farm. These things that you see on the shelves that have been kept for long, they have been put on preservatives, they are not good. You can take them once in a while, but not always, because I don't want to look like I want to break somebody's business or anything. But when they are there, it doesn't mean that you carry them to your house and eat them the whole week. Number two, another risk factor apart from diet is smoking and alcoholism, which is also rampant again in the young people, especially from when we look at Kenya Demographic Health Survey. Actually, we are looking at young people from actually 25 to 35 years who are smoking. There are so many. And also there are all these old wazes from 50 to around 55 years. They are smoking a lot of cigarettes. Any form of tobacco, even these things we call shisha, these things, they are all families of tobacco. There is shisha. Nowadays, I saw another guy smoking on the street. They just have
vape.
Tobacco.
They call it vape.
Yeah. They're just smoking on the street and they have it maybe on something like a small gadget like this. So those things, you will use them when you are still young, but after years, they'll cause lung cancer and other types of cancer. Another risk factor is lack of exercise. And as Kenya is moving to industrialization, actually industrialization comes with its own challenges. So people get seated for long because they are doing a lot of the white collar jobs compared to the manual jobs. So if you look at your children, you want to push them to go to towns to do the white collar jobs. These white collar jobs come with risks of cancer because these guys are seated for so long. Like what I do every day, I'm a doctor. I sit every day listening to patients, maybe doing prescriptions. That gives me a risk for cancer because if I don't do exercise, I can easily get cancer because my lifestyle is a sedentary lifestyle. That mama mboga who sits the whole day, I think their work is not good as they might think. They call it juakali. Juakali is not mama mboga. Juakali is not being a shopkeeper. Juakali is the real juakali where watu wa mjengo, those people, they are the ones who are doing the real juakali. But if you are a mama mboga, you need to stand up, walk around, make sure that 3 hours in a day you are walking around. If you sit there, in the evening you will be tired, but you have done nothing because you are seated on that chair. And you will know it. The moment you start that business, you start with a very small chair. But after 3 years, this chair is now expanding. You don't want to sit, you need a huge one. So it's because of your lifestyle. Then lastly is about obesity. Obesity is a risk factor for cancer. There is also alcoholism. There is also gene mutations. There are people who are born genetically at risk of cancer. Then there are people who are born in families where there is a risk for cancer. For example, cancer of the ovaries, it moves in families. So if you have a sister who has cancer of the ovary, you might have...
You are at risk.
You are at risk. If you have a sister who has cancer of the breast, you are at risk. Esophageal cancer, there are people who are saying taking hot tea, taking what, but we are still doing research about it. But you better just stop taking hot tea. Especially if you are living in a very cold places. You better make sure that you don't take anything that can harm your body. So there are several risk factors for cancer, even infections.
Is age among them?
Yes,
can age be a risk factor?
Age is a risk factor. We are seeing many people who are getting cancer, as I've said. You live your life well from 20 to 40 years. You eat everything, but from 40 years now, whatever you are eating those days causes the cancer. So age, mostly the age incident for cancer, we are starting from 40. That's the commonest age where people are getting cancer, up to 70 years. So these people who are from 40 to 70 years, they need to be going to the hospital every year to screen for cancer. And don't fear. You know, people usually say that if I know that I have cancer, now that is when I will start dying. No.
That is my death sentence.
We want you to come. If it is in stage 1, we'll just repel it off. And for example, if you have cancer of the cervix, it is in stage 1. We just remove the cervix and you are okay. It will not move anywhere. So if you come to us late, it becomes a problem.
All right.
Infections, I talked about infections. There is human papilloma virus, there is HIV. We have people who have HIV, they have never tested. So they live with HIV for more than 5 years. It gives you a risk of so many cancers. Currently, we are also looking keenly at diabetes. Diabetes is also becoming a risk factor for cancer.
Yes.
Many people who have diabetes are developing cancer, especially the uncontrolled type. So if you have these chronic diseases like arthritis, cancer, not cancer, diabetes, hypertension, just make sure that you put them on control. Instead, even HIV itself, put it on control so that it doesn't give you a risk for cancer.
All right.
Yeah.
Now,
And just, if you allow me, drugs, it has been talked, we usually forget about it. There are these drugs that people are using to spray their crops. They are also giving us a risk.
Yes.
I might not mention which ones, but when you go to your seminars, your agricultural seminars, talk to your agricultural specialist to tell you these drugs and how to handle them. You find somebody spraying drugs without a mask, without gloves on. It is a risk to your health.
So that about chemicals and pollutants.
Yes, pollutants.
Yes.
Yeah, so make sure that when you are spraying your crops, you put on gloves, you put on protective gear to make sure. If you don't know how to do it, just look for an expert, pay them, let them spray for you, because they already have those protective gear.
Yes.
Yeah.
All right. Now, Daktari, what does cancer grade and cancer stage mean? When you say it's cancer stage 1, stage 2, or stage 4, what does it mean? And when you talk about it, also you can mention the symptoms that maybe appear at different stages on different cancers.
Yeah, it's a very good question.
Yes.
And that is the question that most people fear a lot. Because mostly we usually do what we call a biopsy, or maybe histology is the better word. So histology is a way of grading cancer in terms of the stages. So when we talk of stages, it does not mean one stage is bad, one stage is good. No, any stage of cancer is a determining factor of the prognosis. So if you have stage 1, for example, the prognosis might be better than if somebody has stage 4. So we look at the inversion, we look at the cell itself, the primary cell, the primary part where somebody had the cancer. For example, if someone had cancer and the cancer is still localized, for example, if you have cancer here and it's still just localized on your thumb, that is maybe, we might call it maybe stage 1 or 2. But if it starts moving to the other,
spreading to the other
parts,
we
start calling them stage 3 and stage 4. And there is always a stage 3A, B, C, depending. There are people who classify cancers differently.
So you can always track where it began and how it has spread.
But of recent, we've noted there are people who have 2 types of cancer. So you might think it is a cancer that moved from one place, and yet it has 2 primaries. We call them 2 primaries. So they had a cancer of the ovary, it moved to the bladder. They also had cancer of the lungs, and it moved to the stomach, to the colon. So if you want to know, now you look at the shape of that cancer, the shape of those cells to determine your stages. So what we look at the symptoms now, a person who is in pre-cancer, and by the way, it is good to know that before you get cancer, you will always be in pre-cancer. Yeah. For example, cancer of the cervix. If somebody has cancer of the cervix, before it moves to cancer of the cervix, they will be in a pre-cancer state for almost 5 years. If you get an infection of HPV, it will take its time. It is not telling you anything, it's not giving you any symptoms, but there is that risk of pre-cancer. So unless you go to a doctor, we'll look at those cells and tell you, these cells might give you cancer in 5 years. No one will ever know. So most people just stay with it because it's not giving you any symptom. Pre-cancer state does not give you any symptoms. So people will just be walking, they are okay, but the cells are at risk of cancer.
Yes.
Now, after those 5 years, that's when the cancer becomes rampant. It starts giving you symptoms, you start bleeding, you start seeing a growth there. That is when you have a cancer. Unfortunately, when you come to us, it might be in stage 4 where it has moved to other cells and we can't do anything. So pre-cancer states, even for lung cancer, there is a pre-cancer state where if somebody picks a biopsy or maybe they pick some cells and test them, they tell you these cancer cells are not good. They are precancerous cells.
Yes.
So we need to chop them off so that we leave the normal cancer cells to grow and cover the region where we had the bad cells that were almost becoming cancerous. So when it goes to stage 1 again, it cannot give you, sometimes you don't have symptoms because it's just the cancer that has now affected the organ.
Yes.
If it is the bladder, it has cancer cells, but it's functioning very well. Maybe it is just giving you some little pain. If it is the kidney, it has cancer cells. It is not giving you anything. So when you go to stage 2, now it starts swelling and it gives you what we call pressure symptoms.
Now the mutation is at a higher rate.
Yes, so the growth and it has now received some supply of blood, so it is growing at a higher rate. So this person will start experiencing some symptoms, and most people usually treat those symptoms as malaria. We've had, I don't know what is wrong with people eating typhoid the whole year. Typhoid and brucella, I don't like those things. Typhoid and brucella are very funny diseases, and people are just treating them. They get 21 injections, 40 injections, for what? Come to us, let's do a blood culture. It will tell us that you don't have typhoid, you don't have brucella, and maybe it could be cancer that you are treating, thinking it's brucella and typhoid. So the moment you see those cells, they are now growing. If you go to stage 3 and 4, obviously you will have symptoms. And that's where people come to us, unfortunately. So we want people to come to us. We look at those cells when they are still precancerous or they are in stage 1. We remove them, you continue with your life. Yeah.
That's why it's always advisable that we go for screening as early as possible, even without experiencing any signs or symptoms of cancer.
Yeah.
Now, Doctor, why do people with the same cancer get different treatments when they are having the same problem?
Pardon?
Why do people with the same cancer, for example, they might be having breast cancer, get different treatments and chemotherapy programs when they are having the same problem?
True. As I've said, it depends on the stage. It depends on the stage of cancer.
Yes.
It depends on the body. Some, there are people who can tolerate this type of chemotherapy. Then it also depends on your risk factors. There are some cancers that we even use immunostabilizers, or maybe medicines that are targeting the hormones. There are people who will use the chemotherapy drugs themselves, not necessarily the hormones. For example, if you have breast cancer, we might use a drug like tamoxifen, which is now actually, it's not chemotherapy per se to burn the cells, but it is modifying these cells to tune to your normal body cells.
Yes.
There are other drugs that people will use like chemotherapy, and it depends also. If a doctor has decided to do surgery for you, they might decide to do radiotherapy for you. So it depends on the stage and also the organ that has been invaded. If this organ that has been invaded is a very technical organ, if we touch it with chemo, it will become a problem. So we want to be sure that whatever we are treating you with is the safest way of treatment. So each person, each treatment is individualized. So that's why you'll see people coming from chemotherapy and they tell you that, mimi nilipewa that chemo that was very strong. The other person will tell you, my chemo didn't take me badly. I was okay. I was done surgery. I was okay. I was done radiotherapy. I was okay. So it depends. It depends with the organ that has been invaded and the type of cancer and even the cells. That's why we do histology. When we are doing histology, we do histology so that we can classify and know the type of cancer that we are dealing with. Yeah.
So that is what that causes the different treatments.
Yes.
And does this chemotherapy, Daktari, have any side effects on the patient?
Yeah, of course, chemotherapy has side effects. You will have the normal symptoms. You know, these side effects, people usually fear them, but they are normal side effects for for any other drug. For example, if you took Piriton today, we will not be doing this show today because we'll be asleep.
It's true.
And sleeping is a side effect of Piriton. Not that you took Piriton so that you can sleep.
It's a side effect.
It's a side effect of Piriton. So any drug that we take in our body has side effects. So people should not fear that chemotherapy will give you side effects. No. Those side effects come, especially the first few days after chemotherapy, then they go off. Yeah.
Now, how can the community at large, for anyone that is watching us right now, how can they be of support to these cancer patients or even the medics?
Yeah. Number one, it's a very, very good thing. And even as we observe, January, we were looking at the Cervical Cancer Awareness Month.
Yes.
And you know, it was so touching to me when I realized that some women are discouraging other women to go for cervical cancer screening. Why? Because of that small gadget we use to screen called a speculum. Surely. You know, women are telling other women that don't go there. Those doctors will put something down there and it will be painful. I mean, this thing has never been painful, especially for those women who have given birth. If you have given birth, you should never fear of screening for cervical cancer because the speculum is not even big. It's not that painful. So there are women who are discouraging other women to come for screening. Only they accept screening when they already have cancer. So sad. Because why would you accept screening when you are already
it has already grown?
And you accept, Daktari, just screen me, just do the way you want. I want to get healed. They accept, you put the speculum, they are bleeding, and all what have you. And yet, they had a lot of time to come to us to just screen. And
Earlier.
And we don't want to do this screening yearly. We want to do it after every 3 years. HPV screening. There are people who are fearing to come for HPV screening. Even breast. There are women who are working with lumps and they don't want to go there because they feel the doctor will tell them it is cancer. So what am I talking to the society? There is a lot of stigma about cancer, which has to be stopped.
Yes.
Cancer is a disease like any other disease. People have to come to us. People have to come to the hospital. They will need to come and come for treatment and maybe screening, especially screening. And if you are found to have cancer, we look at the stages. Even that stage 4 that you think cannot be treated, it is treatable. Who told you that it cannot be treated? I've seen many patients who currently who are in stage 4 cancer and they have been treated. The organ has been removed that has the cancer and they are okay. So let us not have a lot of stigma to cancer patients.
Yes.
When people hear that they have cancer, they come to see you. When they leave that doorstep, they start talking, we are losing this one. We are doing what? Who told you? You might even, there are different causes of death. There are people who get death because of accidents. And it is instant. They lose their lives. So you are not the person to judge people who have cancer and tell them that, you know, if you have cancer, it's a death sentence. Who told you? It is not a death sentence. What we are telling our people, come to us, let's screen early, let's treat you, you continue with your life. And if you have cancer, again, accept. Let people work with you. The burden of cancer is heavy, but it is bearable.
Yes.
If the society can accept, if the society can support the people that have cancer, and especially screening. If you are a woman and you are telling your fellow woman not to go for screening, I mean, that's not good for you. Please encourage other women, especially women who are in the productive age, to come for screening. Men, if you have a prostate, if you are a man, you already have a prostate. As long as you are 40 years and above, go for prostate cancer screening. Very simple. If you see any unfunny symptoms, if you treat malaria, malaria is a disease that is treated for 3 days. You have a headache, 3 days. You have taken malaria drugs and it's not going off. Come for further screening. If you have pains, general body pains on your body, you think it's brucella, you think it's typhoid, you've taken the whole course of treatment, stop there. Come to the hospital, come to a higher hospital, let them screen for you for other diseases. A good example could be blood pressure, could be diabetes, it could be cancer. So we want the society to accept and come for screening. Let's stop these theories and myths that we have about cancer, and we want to save people's life. Yeah.
Wow, that is well said, Daktari. And I've seen that we'll be celebrating the World Cancer Day
Yes.
on 4th of February.
Yeah.
And the World Health Organization have already given out the theme is close the care gap.
Yes.
How can you explain about that, Daktari? Close the care gap, the theme for this year, Cancer Day.
Yeah, you know, World Health Organization is keen at cancer, as
Yes.
I already mentioned in my first part of the show.
Yes.
And even Kenya itself, you've seen on TV, the other day on Citizen TV, you saw where there were all the media groups, even you included, were brought together
Yes.
to just discuss about cancer. And you are looking at how are we moving as a country. There is bigger hospitals like Kenyatta Referral Hospital. There is this KU Referral Hospital. So there are various steps that the country is taking to close the gap to care. But unfortunately, the Kenya per se, people don't want to come for screening. I'll keep on repeating that so that people can hear. People don't want to come for screening. So the theme for this year is closing the gap to access to care, which means that, you know, people still feel that you have to go to India for
Yes.
your cancer treatment.
Yes.
It's not happening in this age, in 2024. No. Cancer treatment is nearer to you. Even that dispensary that is close to you, they can start your cancer treatment. I'll keep citing an example of cervical cancer.
Yes.
Currently, there is a portable machine that can be able to prevent the precancerous cells for cervical cancer from spreading to cancer. Currently, there is a nurse in your dispensary there whom you can just visit her office and tell her, today I have not come for malaria treatment, today I have not come for typhoid treatment, I've just come so that you can educate me on cancer. In your community, there is a CHB, community health promoter.
Yes.
That community health promoter, his or her work is just to educate you on cancer, then encourage you to go for screening. So the care is closer to you.
Yes.
Starting from that community health promoter. If you reach them, ask them, they'll teach you on how to prevent for cancer. Then for those who already have cancer, again, as a country, we are streamlining things. Those machines you thought they are in India, currently they are in Kenya. There are very sophisticated machines currently in KNH, in MTRH, in KU, Teaching and Referral Hospital. So even Mama Lucy and many other hospitals.
Yes.
There are also some other machines here, doctors who have been trained to take care of cancer, even in the sub-county hospitals, the county hospitals. So cancer care is closer to you. That's what we are saying. So we want people to come out, screen. If we get you in stage 1, stage 2,
Yes.
let the doctors be busy treating it. Then you just waiting for stage 4, then we start raising funds for you to go to India for treatment. So that's our theme today. Let's screen, let's get access to care as early as possible.
Thanks so much, Daktari. That is well explained, and for our viewers, they have gotten it right. Any last remarks before we wind up?
My last remarks as we look at World Cancer Day, you say this on 4th
yes,
of
4th.
this month. We want to encourage our people to come for screening. We are ready, more than ready. I think if there is a country that is invested in cancer care, is Kenya. So let the people come for screening, let the people be there. And for the cancer warriors, we call them warriors, people who are survivors.
Yes.
We also have groups for the survivors. They are those people who can support you. So don't walk this journey alone.
Yes.
Get to the hospital, ask them, is there a group that I can join so that I can work with my fellow cancer patients?
Yes.
So that you don't walk this journey alone. You know, sometimes when you are on treatment for cancer, there is that obvious crashing moment
Yes,
where
yes.
you get depression and other things. But if you have people who can hold up your hands, I know families can give up on cancer patients, but there are people who are out there who can support you, and the family is supporting you so that you can come out of this pain of cancer. Then for those who are in pain because of cancer, again, the country is working on a way of reducing the pain. So there are drugs like morphine that are available in most clinics. If you visit your county hospital, you don't need to go all the way to MTRH to manage cancer pain.
Yes.
You can come to the county hospital. There is a palliative care clinic there where people will take care of your pain, your tears, everything that you feel like is burdening you because of cancer.
Yes.
Then pick up NHIF. NHIF will help you a lot. When you are going for chemo, it will cater for almost everything. When you are going for radiotherapy surgeries, when you are going for surgery, it will take care of everything. So if you don't have NHIF, and even screening currently, even mammograms, those women who are willing to do breast checkups, NHIF will take care of that. So we want people to come out because of cancer, support people who have cancer, and we even request the partners, the NGOs, to pump in some money to the Ministry of Health. You can see what National Cancer Institute is doing. We can see what National Cancer Control Program is doing. So we are encouraging other partners to come on board, support these cancer patients, because cancer is a disease that you never expect it will find you, but it comes. So we need people, very many key stakeholders, to come on and support us. Yeah.
All right. Thank you so much, Daktari, for spending time with us and discussing about cancer. I hope that our viewers are now well informed. And if you have any questions about cancer, any type of cancer that you may want to know about it, just leave your question through our SMS line appearing on the bottom right of your screen. You can as well follow us on YouTube at Imani Television. That is our YouTube channel. Ask your question there. And if you miss this program, you can as well follow it up on YouTube and watch it and get this information directly to yourself. My name is Barasa Saenyi. It is the end of Health, Hygiene and Wellness. I've been having Dr. Silas Wambulwa. Till next week, have a blessed moment.